All right. Hello and welcome, everyone. I'm Nuri from the Massachusetts Health Connector, and I'm joined by my colleagues, Nikki, Dalia, and Melissa, who will be presenting today's information. Together, we are here to share information about open enrollment for plan year 2024, whether you're considering changing health insurance plans or enrolling in coverage for the first time. We'd first like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we do want to share some information about our presentation format. First, everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period, but we will pause for 1 or 2 questions during section breaks. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout, and we do want to note that there are many folks joining this webinar today, so while we may not be able to get to every question asked, we will do our best to address the broad and overarching themes of the questions received. We ask that you please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local sister. We also want to note that we are recording today's webinar, and following the session, you'll receive an email with the presentation and materials used, so there's no need to take detailed notes. All right, and with that being said, I will hand it over to my colleague, Nikki, who will get us started.
Thanks so much, Nuri. And again, thank you everyone for joining us today. It's so great to see such a large number of individuals interested in today's topic. So I'm going to get right to it. So I'm going to cover a couple of sections, and then I'm going to pass the baton over to one of my colleagues. We will be talking about the Health Connector's open enrollment. So we are grateful that you are joining today's webinar just before open enrollment ends. So we will be talking to you about what needs to be done. We'll be talking about the deadlines. And then my colleague, Dalia, is going to talk about things to consider for 2024. What are the new things that are available? How to compare your options. And then lastly, we'll round it out by talking about where you can get some additional help. So let's start with what is the Health Connector's open enrollment. So for those of you who are less familiar with the Health Connector, we just want to acknowledge that we're the state's health insurance marketplace. We are here to offer coverage for individuals, families, small employers, essentially those who don't have access to affordable health insurance coverage. So you might be wondering, okay, well, who exactly is this? And really, it's people who don't get health insurance through their own job, a job of their spouse, a partner. Maybe someone works a couple of different part-time positions and they're not offered employer-sponsored insurance. Now, a lot of people who apply for coverage through the Health Connector do get help paying for their premiums. And it's also important to note that people can buy dental insurance through the Health Connector as well. And lastly, not the topic for today's presentation, but it is important for us to note that we do offer a business platform known as Health Connector for Business for those employers that have 50 or fewer employees. So if anyone is interested in signing up for a webinar about Health Connector for Business, if you have a colleague, family member, etc., just take a look at our webpage or even Eventbrite, and we'll be preparing to post additional webinars for the 2024 calendar year very soon. So I'm going to dive right in and just talk a little bit about Health Connector plans, give you a little bit of insurance speak, just so that you have some context as we're going through the rest of these slides. So I've already acknowledged that the Health Connector is the state's health insurance marketplace. So all of the coverage that you would purchase, anyone would purchase through the Health Connector, does meet state and federal standards for coverage. So as a consumer, you do not need to worry that any coverage doesn't meet minimum creditable coverage or minimum essential coverage. It is comprehensive coverage. You would not be penalized on taxes if you were enrolled in any one of these plans. Now, if you look to the left here, the first item says qualified health and qualified dental plans. That's just technically what all these plans are called. So qualified health plans, qualified dental plans basically just means that all the plans meet the standards, and depending on where someone lives, they're going to be able to choose from a variety of health and dental plan options based on the insurers available in that area. Now, what is unique about coming to the Health Connector or going to a marketplace is that is the only place someone is able to access any advanced premium tax credits. So this is where people qualify for tax credits to reduce their cost of monthly premiums. I'll get into this in more detail a little bit later. But again, it's really important for you to know that this is the only place where the Health Connector is the only place where someone can get those savings. And then lastly, for ConnectorCare, just want to note that that is unique to Massachusetts. So not just unique to the Health Connector, unique to Massachusetts. If you are in a certain income range and you meet all of our other eligibility requirements, you might be eligible to enroll in a no-cost or a low-cost health insurance plan that also has comprehensive benefits and no deductibles. So again, more details to come, but we wanted to just give you the landscape. Now, open enrollment. So we're guessing that many of you are here today because you know that open enrollment is coming to an end. Open enrollment started on November 1st and will be ending on January 23rd. So just a few days from now. And then we'll get into what's known as our closed enrollment period. And that will take us through October 31st of 2024. So let me just, talk about those two and explain what the differences are. During open enrollment, essentially, this is the time of year that anyone can apply for new coverage for the coming year, or they can review their application, renew their coverage, and shop for a new plan. Now, since we are in the month of January, basically, people still have time to enroll into coverage that begins on February 1st. So all of the Health Connectors plans begin on the first day of each month. So if you are interested in enrolling in coverage, you would need to complete your application, choose your plan, and enroll and pay for that plan by January 23rd. So we're going to show you how to do that all today. Now, what happens if you need coverage and it's after January 23rd? Someone, let's say, may lose a position, lose access to their health insurance coverage. There are a number of things that can, in fact, change that would, make someone be in that situation. So a lot of these situations are known as qualifying life events. And basically, if someone has a qualifying life event, it lets them enroll in or change their health insurance plans outside of our open enrollment period. So these types of life events are things like changes in your household makeup. So let's say you have a young adult who moves out and moves on their own, and they're no longer part of your tax filing household. Or your income goes up or down. There's a change to immigration status, or even if you've moved from one part of Massachusetts to another part of Massachusetts. These are all things that essentially allow a special enrollment period to happen. Now, we require that you report any qualifying event within 30 days of it happening, and then you have 60 days from the date of the qualifying event to select a new plan. Now, when you're going through this, you still have to abide by our, payment and enrollment deadlines, but you really do get a window so that you can come in and make changes and get the plan that you may need. So this is a great segue into what needs to be done during this time and just going through what these deadlines are again. So I want to start off from this page. I think it's important to note that there is one application for individuals and families in Massachusetts if they are looking for health insurance coverage and they are 65 years or younger. So whether someone is an existing Health Connector member or Mass Health member, or they're newly applying for coverage and they don't know what coverage they're going to enroll into, they're going to start from one page, and that's mahealthconnector.org. And from that area, you can access our application for individuals and families. That's available in English, Spanish, as well as Portuguese. So someone can answer the questions, submit that for eligibility, and get a result and see what to do next. Now, it's really important to note that when you come to our landing page here, as shown, you can either choose to sign in or to create an account. And if you are an existing member or you've ever completed an application, we really want to encourage you to sign in. And it's okay if you've forgotten your password or your username. You can get assistance retrieving that. But it is really important for you to go back to the application that you originally started with so that there isn't a duplicate application or any other confusion. So it'll just save you a whole lot of time. And lastly, really important to acknowledge is that there is one application for the Health Connector and Mass Health. So this is all one and the same. And when you enter your information into this application, you don't need to know, again, what it is you are going to qualify for. The system will figure it out. The application will figure it out. And you just, want to look for your result. So what you need to do, and it's really going to depend on who you are. So all of these activities really are in an effort to get you into a plan that starts on February 1. So if you are, where you need to start is either to update or submit your application. So if you're an existing member, update your application. So I was stressing this on the previous page, but please do not create a new application. You want to find your previous one and report any income changes, household changes, etc. But if you're brand new, you can create an account and then complete an online application. Now, in terms of reviewing your program eligibility and just to see, what savings you're eligible for, etc., it's going to be really, really important to make sure that you don't owe any documentation or proofs so that your eligibility result is as accurate as possible. My colleagues will talk about this, I'm sure, during questions, but there are deadlines to submit proofs, and we'll talk to you about different ways to do that. And then lastly, once you know what you qualify for, you want to shop for plans, compare them, and then choose your plan. And again, you can do this by January 23rd, and you can still get into coverage for February 1st. Now, super important is that if you owe a monthly premium, you have to make that payment by January 23rd in order for your coverage to become active on February 1st. So if you are new to this process, you might be wondering, okay, well, what are the requirements and then what do I need? So this is where I usually, would tell people to get a cup of coffee, get a cup of tea, whatever, whatever you need to do, but you want to gather a few things. In terms of eligibility requirements, you need to be someone who's living in Massachusetts. You need to be someone who's a U.S. citizen, U.S. national, lawfully present, essentially lawfully being here in the U.S. And if you're looking for help paying for your coverage, you need to not have health insurance or have access to health insurance from another source. So if you are enrolled in Medicare or Medicaid, which is Mass Health, or let's say you are getting comprehensive coverage through the Veterans Administration, you don't need to apply. And you won't be able to access savings through the Health Connector because you already have coverage through another source. Also, if the coverage that you're offered is considered affordable and it's comprehensive coverage from an employer, you would not be able to get coverage through the Health Connector and get help paying for that coverage. And lastly, if someone's incarcerated, there are other paths for coverage. But in terms of gathering what you need, you want to gather any social security numbers for anyone who's applying if they have them, any immigration documents that you may have if you have some. If you have questions about those immigration documents, you can take a look on our website. We've got a ton of great resources there, and you'll be able to kind of compare your documents with what is online just to make sure you have all the information that you need. In terms of payment, pay information or income information, you want to get together information about yourself. So if you have a paid position, you want to get copies of your last 2 pay stubs. If you are self-employed, you want to gather information about your net income. If you're unemployed, you want to get the information together from your monetary determination. So basically, it's what the Division of Uninsurance essentially is sending to you. Now, this is really important. If you don't have all the information that I'm outlining here, don't worry. You're going to get to a point in the application where it will tell you, where we need more information from you or where we might need proof so that you can access that coverage. You could still enroll in Health Connector coverage while we're waiting to get that information. It's just going to be, again, you've got to take care of that within the deadline. Now, we always get lots of questions about income. So I know as you're going through the application, you're going to be asked about income in a couple of ways. You're going to be asked about your current income, and then you're going to be asked about your projected income for the year. So what we want you to do is take a look at the different types of sources of income that you have. So on this list here, you're seeing things like your salary, your income. On this slide here, you're seeing a variety of sources of income, things that you want to include, as well as things not to include. So things not to include are things like child support. If you're getting supplemental security income, I want to just note here that if you're getting Social Security payments, including disability payments, you do need to include that as part of income. But again, all of this information is listed, detailed on our website. And I believe Nuri said this at the beginning, but it's always a good idea for us to repeat this. You will be getting a copy of this slide presentation with all the links within a day of this webinar. So you'll have all of this information at your hands. So no need to take detailed notes. You will have all of these details in your email box. Now, after you apply for health insurance coverage, there are a couple of really important things that you're going to need to do. First, you need to be on the lookout for any information from us or Mass Health. As I said, if you don't have all the information needed, you'll get a letter. And then if you need documents, if you owe any documents, there is a 90-day time frame where you can submit the documents that you owe. Now, as you're going through the year, things change, things happen. So we really just ask that people keep their applications as updated and accurate as possible. So doing this does a couple of things for people. It will give you the right amount of help, the right amount of financial help paying for your health and dental insurance. And then for people who enroll in Health Connector coverage, you're going to have a lower risk of owing money back to the IRS when you file taxes next year. Now, the reason that is because, again, we talked about getting advanced premium tax credits at the very beginning that could help pay for your premium. Now, if you get advanced premium tax credits or you're eligible for them, you get to decide, like, okay, this amount looks good to me. I would like to perhaps use all of those advanced premium tax credits you get to decide if you want to apply all those tax credits that you become eligible for, or if you would prefer to adjust down the amount you take, and kind of just to excuse me, if you're not sure of your income, if you think it's going to fluctuate, you can adjust that amount so that you have less tax responsibility at the end of the year. So this link here gives you some information on how to update your income, your information, and I'm sure we'll be taking plenty of questions about advanced premium tax credits during Q&A. So with that, Nuri, maybe we have time for a question or two. I didn't look at them, but I see that a number of things have come through the Q&A.
Yes, Nikki, thank you. We have a lot of great questions here. Why don't we get started with COBRA? So a lot of questions related to COBRA. If someone enrolls in COBRA, first, can they leave at any point in time if it becomes too expensive, for an example? And second, does losing COBRA or if you expect your COBRA to end soon, does that open up a special enrollment period that you mentioned outside of open enrollment?
So the answer, so there's a two-part answer, and then I think I'm going to ask my colleague Melissa to jump in as well. But open enrollment is a perfect time if you are in COBRA and you're thinking, okay, this has become too expensive for me. During open enrollment, you can drop COBRA and you can join Health Connector. And then if you were enrolled in COBRA and the COBRA ends, you can certainly come to the Health Connector whenever it ends, because that will give you a qualifying life. That's a qualifying life event, and that will give you a special enrollment period. And then I'm going to ask Melissa if I missed anything. Please just jump in.
Hi, thank you. No, Nikki, I think you covered everything. That was perfect.
And can I ask one more question related to loss of coverage? So now with the Mass Health redeterminations, if someone is determined no longer eligible for Mass Health, can they apply for the Health Connector?
So I'm going to answer this if that's okay, Nikki. So yeah, that would be considered a qualifying event when you lose access to coverage. So you can come in and apply for the Health Connector. You would be eligible to apply.
Great. Thank you so much, Melissa. And thanks, Nuri. So with that, I just want to hand this over to our colleague Talia to take us through the next couple of sections.
Thank you, guys. So we're going to talk about what's new for 2024 coverage. So starting in 2024, the Health Connector will be expanding eligibility for ConnectorCare plans as part of a pilot program. The ConnectorCare program, which combines federal and state subsidies, will now provide lower premiums, co-pays, and no deductibles to more Massachusetts residents in 2024. And even if you aren't eligible for one of our ConnectorCare plans because your income limit exceeds the limits, you might still be eligible for the advanced premium tax credits that Nikki was talking about. And whether you select a ConnectorCare plan or a plan with advanced premium tax credits, you can be assured that they both will meet state and federal standards and lower your premium bills. As previously mentioned, whether you're eligible for tax credits or a ConnectorCare plan, you have the chance to save on your monthly premium. So with the advanced premium tax credits, the IRS will send the credits directly to the insurance company, so you'll pay less each month, and you can always decide how much of that tax credit you choose to apply towards your monthly premium. And with our ConnectorCare program, your monthly premiums are lowered using both federal and state funds if you are eligible for a ConnectorCare plan. And like we previously mentioned, these plans have low monthly premiums, low out-of-pocket costs, and no deductibles. And when you qualify for a ConnectorCare plan or the program, you will be able to select a plan type, which is based on your income and your family size. And And this will determine how much you pay for your monthly premiums. And we'll see those plan types in a few slides. Also new for 2024, all insurance companies who participate in the Health Connector will now offer plans in our ConnectorCare program, and you can see some of those plans on the screen: Ballin Health, Health New England, Mass General, Brigham Health. All those plans that are displayed now on the screen will now have plans with our ConnectorCare program, which means more health plan options for Massachusetts residents. And these new options became available for those who qualify for a ConnectorCare plan as of November 1st. So what does this mean for Massachusetts residents? So very generally speaking, that means that in 2024, individuals and families with higher incomes will now be eligible for ConnectorCare plans. So for example, an individual person, we've increased the income limit from $43,470 to now $72,900 for 2024. And for a family of 4, that income has been increased from $90K to $150K for 2024. And like I mentioned, if you qualify for a ConnectorCare plan, you will need to select a plan type that is based off your income. So the dollar amount that you see on the chart here on the screen is the minimum amount an individual could be paying for each of these plans. And that could be as low as $0. So for example, the lowest cost for a plan in the type 2A column would be $0. And the lowest cost plan in 3B would be as low as $142. And to reflect that increased limit for the ConnectorCare plans that I previously mentioned, we've added 2 new plan types, which is 3C and 3D for 2024. Okay, did we want to take any questions now between sections?
Sure. So can we just go back to this 23rd deadline for coverage that you guys continue to mention? And can someone please clarify whether or not that only applies to this particular month of January for February 1st coverage, or does that apply for any future months that I, as an individual, let's say, may need health insurance?
Okay, so you can actually apply at any time as a new member. The only time, so the open enrollment is actually just a time where you can go in and change your plan. So it's November 1st to January 23rd, which is our open enrollment. But if you are a new member coming in, you can come in and choose a plan. And then outside of our open enrollment time, if you do have a qualifying event, you can make changes to your account.
And Nuri, can I just add that everything Melissa said was correct, and also that the deadline, when we keep talking about this 23rd deadline, it does apply every single month throughout the year. So that 23rd deadline really is like the cutoff point so that somebody's coverage can begin on the 1st of the following month. Does that answer the series of questions?
Yes, that answers the question. And then if I can just like follow up very quickly with just the applications itself. So is it one application for open enrollment and another application if I do have a life qualifying event, or what would be the application process itself for that?
So it's just, Melissa, I'm going to let you explain the difference between our application, the renewal application, and that it's really only one.
Okay, thank you. So yes, it's actually only one application. So basically what you would do is you would sign in to your application, and then we have a section where you can make changes to your application. And then it basically leads you, so let's just say, for example, you want to go in and change your income. There's a series of questions that you would answer in the application. But you just want to make sure that you stick to that one application so you don't create a duplicate account. Hopefully I answered that. Nikki, did I?
I think we covered that one. So there isn't maybe, they were asking if there was like a special application. There isn't. Maybe another thing we could add for people, because I mentioned it briefly, but it is really important. This application is really for people who are 65 years of age and younger. If someone is over 65 and they're looking for access to mass health and mass health long-term care, that's a completely separate and different process. This application is the online application for Health Connector and Mass Health for those who are under 65 years of age.
Okay, so I want to quickly go over some of the tools that we have available to help you compare your options and save on plans. Melissa will be going through these in a bit more detail, but these are some factors that you should consider when shopping for health insurance. The first is premiums, which is the amount you will pay monthly for your health insurance. We like to compare premiums to a gym membership, whether you go once a week or every single day in the month, you still have to pay that bill monthly to continue to attend your gym. There are covered benefits, which are the services that carriers agree to pay for you when you enroll in their health plan. And depending on the services and the carrier, you might be responsible for paying a portion of those services. And that portion that you're responsible for paying will be your out-of-pocket cost. And lastly, something to consider is the network that someone chooses to enroll with, which includes doctors, specialists, and hospitals. And this will vary depending on the carrier and plan type that you select. To help new and returning Health Connector members, we have a few great tools that will help you compare and select health insurance plans. These are the tools that Melissa will be demonstrating for you all very shortly. Our most notable tools are our Get an Estimate tool and our Plan Comparison tool that are available to everyone outside of their individual application, just meaning that you don't have to sign in to your account to access these tools. These tools allow you to see what plans are available in your area and give you an estimate of what your savings might be. The Plan Comparison tool helps you find providers and facilities covered by these specific plans. Now, when you use the Plan Finder tool, it works very similar to the Get an Estimate tool and the Plan Comparison tool, but it is more precise since it is based off the information that you provide in your individual application once you have logged into your account. So after you've used all your tools and done your research, we want to remind you that enrollment is not complete until you have made your first premium payment. And in this case, you would need to make your first premium payment on January 23rd to obtain coverage for a February 1st start date. And for our existing members, Health Connector members, there will still be time to go in and change your plan if you receive your bill in the month of January and it is not what you expected. You'll have until January 23rd to go in and make changes to your application and select a different plan. So here is just an example of what your monthly bill might look like. It'll break down your monthly premium, show the advanced premium tax credits you choose to apply to your premium, and if you're eligible for ConnectorCare program, it'll also show the state and federal funds being added to your account. And there are a couple ways that you can make your monthly premium payment. One of the three ways are an online payment through the payment center. Just a reminder that it has to be through a checking or a savings account since we do not take credit cards or cards. And you can also pay by mail, or this is a new feature, over the phone. And I will pass it back to Nikki.
Thanks so much, Talia, and thank you everyone for staying with us. I'm going to, before I do that, Nuri, are there any questions? I'm so sorry, I was jumping right into the slides. but we're happy to take any questions if anything does come in.
Thank you, Nikki. So just before we got into the section, you had mentioned information for folks who are actually over 65. Would you mind just repeating that for folks who might have missed it, just being able to redirect them in the right direction?
Sure. So if there are people on the call who are over 65 years of age, or you're considering, you're thinking about Medicare and trying to understand more about Medicare, it's probably best to reach out to the Executive Office of Elder Affairs. There's a group called SHINE, and they're SHINE counselors, and it stands for Serving the Health Insurance Needs of Everyone. And we can do a little Google searching and paste it somewhere, maybe in the chat or the Q&A. But these SHINE counselors are great. They'll help you they'll help you figure out what you need to do and kind of what all your different options may be for your particular circumstance. So they can support that.
Thank you, Nikki. And we have a lot of questions in the Q&A regarding income. Just want to mention to folks that Melissa, our colleague here, will be walking everyone through live demonstrations and more specifics related to income. So, but before that, if I may ask, let's say, so if someone has an application and they report an income on there, but but their income has a significant change, how does that impact, if it has any impact, on the cost of their plan selection?
Melissa, do you want to take this one?
Sure, thank you. Yes, so what you want to do, if there's been a change in your income, you just want to feel comfortable going into your application, just sign into your account, and there's a section where it indicates that you can make edits to the application. You want to just click on that, and then it brings you right to the income portion of your application. So you want to input the changes there. So basically you would put in how much you earn, if you earn on a weekly or bi-weekly, and then you want to give your projected yearly income. And so your eligibility would change based off of that information.
Yeah, so the one thing I would add is, so you could see somebody could see the price of their monthly premium go down, or they could see the amount go up. It's really going to depend on whatever happened that you reported.
All right, thank you. Nikki, and I'm not sure if you're able to answer this question, but what if I'm someone looking to get supplemental insurance for a disabled individual?
I think that's outside of the scope here. Typically, individuals with disabilities are getting, or I shouldn't say typically, not always, could be getting benefits through Mass Health. So I would recommend reaching out to our colleagues there. We can also include a link to their call center in the chat.
Also, if I can chime in real quick, there is a section where you can indicate that that member is disabled, and then you'll probably get information in the mail regarding that through Mass Health.
All righty, thank you. I'll allow you guys to proceed.
Okay, I think this is my turn now. I'm going to show some demonstrations, or is it? I'm sorry.
I'm so sorry. No, I apologize. I was coughing. I had to I'll quickly do this, and I'm going to hand the baton back to you. So don't go too far.
Okay.
So in terms of getting help, we just wanted to make sure everyone knew where they could get some additional help. It's really great that you're here with us today trying to get more information. But we really wanted to make sure everyone knows that you can get free help through the Health Connector, through our customer service, and then also through our local community partners. So I want to describe those two options. So for customer service, you can reach us at 877-623-6765. We also have a TTY number for those who may need it. And then in terms of hours of operation, we're typically open from 8 to 6. But as we're nearing the end of open enrollment, you can go to our website and there will be extended hours. Also throughout open enrollment, we've had a series of events in a variety of communities. People can also get support at these local events. So you can certainly check our website and see a list of these events or any events that are maybe in your area right now. But I think what we've been hearing more and more from people is that they really like to work with a community partner, in addition to customer service. You always can call customer service, but we have trained and certified navigators and certified application counselors who work in organizations across the state. They speak many languages. They tend to speak the languages that are reflective of the communities that they're serving. And they can help somebody add application. They can help somebody with plan selection. They can even help answer questions after the fact. So really, if you, we're getting really close to the 23rd deadline. So I would say if you wanted to speak to somebody in your community, call and see if you can get an appointment, or just start with customer service. I think there was a point I always make on these presentations, and I didn't make it today, so I want to really make sure I stress this. If you start your application, it doesn't matter how far you get. If you get stuck in any way, you can pick up the phone, call customer service, and if you give them permission to access your account, they can pick up wherever you left off and get you across the finish line. So we really want to encourage people, as we're getting closer to the end of open enrollment, that you still have time. There are lots of people out there who are available to help you, and they can help you. We don't want anyone to feel like they're stuck. So now, Melissa, I want to hand it over to you. Nuri, if it's okay, can we just go into the demos? Because I know that people.
Yes, that is perfect. Thank you.
Okay, great. Thank you so much. Melissa, all yours.
Okay, thank you so much. And just a reminder that we will get to the questions at the end. We just want to get through the presentation and share the resources that we have. So if you do have a question, just please be patient with us. We will get to it as soon as we can. So let me go ahead and share my screen. Okay, hopefully everyone can see that.
Yes.
Perfect. Okay, so this is the fun part. I love this part. This is the part where you can see your savings. So I'm going to start with the Get an Estimate tool. So here is our renewal page. And if you just hover above Get an Estimate on the top of the screen, you'll see two options here. You can either go to individuals and families, or you can go to businesses. So I'm going to click on individuals and families. So basically, this is if you don't want to do the whole application, you just want to see exactly what you would qualify for and what type of savings you would have. So it's pretty simple. You would just choose your coverage year. So I'm going to select 2024. And then you would want to enter your Massachusetts zip code. And I'm just going to select a random zip code. And then here you want to enter what you think your household income will be for the year. And I'm just going to say about 45,000. And then I'm just going to say that this is for one individual. And the age of this individual, I'll just say 45. And then here you have options when you select the person's age. You want to also consider if you want to check off that this person needs coverage. And then you also want to consider if this person is pregnant or if this person is disabled or blind. And the reason for that is it could put that person in a different eligibility category. So you definitely want to pick whichever pertains to the person. So then now I'm going to go to my results. And then you just get a reminder that this isn't an application for health coverage. This is just an overview of what you could possibly be eligible for. So I'm going to continue. So here we have the estimated eligibility. So again, we are shown that this is a household member who is 45 years old. And this person is eligible for the ConnectorCare plan with advanced premium tax credit. So this person is going to receive a maximum tax credit of $207. And they're eligible for silver plans with monthly premium as low as $210.12. So that is huge. That is huge savings per month. So we want to preview the plans. So I just click on preview plans. So now we have a further breakdown of basically, again, what this person would be eligible for and what type of plans and how much exactly would they be paying. So this is a 3C ConnectorCare plan type. This person falls into the 308.64% federal poverty level, and their monthly advanced premium tax credit for their tax household would be $207. Now, that $207, that's optional. And if you choose to have that option, you can put that toward your monthly premium cost. So for example, if we continue to scroll down, we have a breakdown of the carriers, the plan name, the coverage level, and then the monthly premium. So for this first example, we see that this person could have a Boston Medical Center Health Net plan. It would be a silver plan. So they would be potentially paying $417.12. But if you add that $207 advanced premium tax credit, they would only have to pay $210.12. That is huge savings per month. And then if you just go further down, you see the same thing. You see the carrier and you see your savings. So for this, if you selected the Tufts Health Public Plan, that's also a silver plan. Monthly premium would be $442.19. But if you selected the advanced premium tax credit you were awarded, you would subtract that and you would end up with $235.19. So that is great savings. So then if you continue to scroll down, you have the option to start over. If you made any type of mistakes, you can start over and you can play around with this tool. If there's more people in the household or you wanted to try something else, you can give it a shot. Or at this point, if you feel comfortable, you can also apply, and we have the selection here, apply now. So that's great. So what I'm going to do now, I'm just going to go back to the page where I started from. So here we have a little message here regarding our open enrollment, which ends January 23rd. So if you're a new applicant, you would obviously select the new applicant and you would have to create an account. But I'm going to say that we're renewing members. So I'm just going to click on that. And I just want to show you the resources that we have. So once we get to this page here, if we scroll all the way down, we have some resources here, and I'll go through each and every one. So the first one here is that you want to review your 2024 eligibility and plan. So if you're a returning member, you will get a packet during the mid-October to mid-November. And during that time, you want to come in and you want to review the information that we have in your account. And you just want to make sure that everything is accurate and up to date. And then here we have the compare changes for 2024. So your premium for 2024 may be different than it was for 2023. For some members, you may need to update or confirm your 2024 income to make sure that your eligibility information is correct. You can compare any changes to benefits and costs in your plan benefits using the plan comparison tool. So now we want to check providers and prescriptions, and I will go over this. So you want to go to our Plan Finder tool to see which plans cover your preferred providers, such as doctors, facilities such as hospitals and community health centers, and prescription drugs that you want to use in 2024. So let's check out this tool here. I think this is very important in making the decision in exactly what type of plan you want to select for the upcoming year. So now we're here, we are at the plan comparison tool. So we want to continue. So here, we just want to give a brief, answer these brief questions here. So you want to put in your zip code where you live. And then you want to, question number 2, do you qualify for ConnectorCare? And we're going to say yes. And question 3, what ConnectorCare plan type do you qualify for? And we're going to say plan type 3. And we continue. So here we want to put down which doctor that we use. So I'm just going to pick a doctor from the list here, and I'm just going to say, for example, I have this doctor here. I love this doctor. I want to continue having treatment with this doctor here. So I will continue. And then we will choose the facility, and I'm just going to pick a random facility. We'll just say Brigham and Women's Hospital. And then here we want to put in, let's just say we currently take prescription drugs, and we want to make sure that that is covered with whatever plan that we select. We just make sure to choose that drug. And now we can go ahead and compare plans. Okay, so now that we see that there's 3 plans available for this person in their area. So it gives you a breakdown. So we see the plan type, and then if you scroll next to the plan, you will see whether or not the doctor, the prescription, and the facility is in network with the plan. So if you want to continue to have your provider and the facility in network, you just take a look and see. So for example, this first one, Mass General Brigham Health Plan, if we hover above your drug category, and we see here that Ativan, the prescription that I put in, this is not in their plan. And then if you go next to that category, your providers, we see that the doctor is not listed for this plan. So the doctor would not be considered in network. But we see here that the facility actually is in network, which is Brigham and Women's Hospital. So based off of this information, you can make a more informed selection with what kind of plan works best for you. So that is really great tool to have. So I'm going to go back, and I'm going to go back to our renewal page. And just real quickly, I just want to just say that you can compare health plans online. You just simply have to sign into your account to find the best one that fits your budget and healthcare needs for 2024. If you change to a new plan that starts January 1st, 2024, you just need to complete your plan selection and pay by December 23rd, which we have already passed. But again, the deadline every month when you make your selection would be the 23rd of the month in order for your plan to take into effect and be active the following month by the 1st. And then this last thing here, and then we can take your questions. This is just a reminder that we have different ways to make payments to the Health Connector. There are 4 ways that you can make your payment. You can go either online, you can pay by phone, you can pay in person, or you can pay by mail. And we also have a really great feature, which is the auto pay. If you just want it to be debited from your checking or savings account, you can select that form of payment. But again, the only forms of payment that we do accept is checking or savings account. We do not accept credit card or debit or any other type of electronic payments. So that is the end of my demonstration. So now the exciting part, we can finally take your questions. I see a lot of questions coming in, so.
And Nuri, I'm also noticing the time, if it's possible, I can stay an extra 5 or 10 minutes if people, I don't know if others are able to as well, just in case. Just, okay.
Yeah.
Definitely, yeah.
Okay,
Works,
great.
Nikki.
So happy to, we're happy to take as many questions as we can.
All right. Thank you, Melissa, for the demonstrations. Would you just mind reminding folks what type of income they should be reporting? Is this like net, adjusted, gross income? Just briefly touching on that point again, please.
So we accept taxable income, and when you're submitting your income information, you want to make sure to put in the gross amount, not the net,
For 2024.
for 2024. Yes, correct. Yes, thank you.
And Nuri, can I add to this? Because I feel like we always get questions about people saying, well, how do I know what my income is going to be? How do I project? Depending on the time of year, sometimes it's easier than others. So when we were doing this, giving these presentations in November or December, someone just needed to look back over the calendar year and say, okay, how much income did I make at my job? How much income did I make? How much income did I make elsewhere, like my side job, et cetera, that's taxable? And just give a general estimate. Now, when you're at the beginning of the year, and you don't really, you don't have a crystal ball. You don't know exactly what's going to happen this year. That's where Melissa had suggested, you enter what you know, whether you're going to get paid every other week, whether you're getting paid monthly, enter what you know, and then get comfortable with coming back into your own application and making those updates. It is hard for people to know exactly what's going to happen unless you've been in a position for a really long time. So just something I want to point that out because I feel like those are questions we always get.
And just want to chime in real quick. I know it can be uncomfortable sometimes going into the application and making those changes and feeling confident that you made the right change. So just always feel free to reach out if you feel confused or you need help with anything. We have assisters and people that are here to help you. And even if you speak a different language, we can use a language line. So please always feel comfortable reaching out. We are here to help you.
And regarding same income questions, so for folks who are currently unemployed, what is the recommendation for them? And then touching on a different population of those who are actually self-employed, if Melissa or Nikki could speak to those again.
So why don't I take
specifically, sorry, for reporting income?
Okay, so if someone is self-employed, I think it's helpful to everyone would be handling their income differently. Sometimes people are using tax specialists, etc. Sometimes people are paying like quarterly. If they're self-employed, they're paying quarterly payments to IRS and DOR. So I would suggest that you figure out or try to estimate what your net income is going to be for that quarter. You could come in every quarter and make updates. There's no time of year that you can't come into your application. And then Nuri, I apologize. I think Melissa's going to need to answer your other question because I forgot how you phrased it. I'm sorry. For individuals and families, as it related to income, you wanted to know.
So it was for unemployed and then those who are self-employed.
Okay, so for unemployed, I'm sorry, Melissa, definitely jump in anytime you want. But for unemployed, once you become unemployed, you typically get, I think I mentioned the word monetary determination. I don't think anybody uses that word other than like us if we're talking to our colleagues at Division of Unemployment Assistance. But basically, if you go into your online account with DUA, you will see the total amount that you're going to get each week. And my understanding is that you also are given a time frame that you're going to receive that amount. So you almost want to make like a little spreadsheet for yourself that outlines every month of the year when you were getting income, if you were getting income for part of that year, when you were getting unemployment for part of that year, and you want to total that. Now, you might be wondering, okay, I have a circumstance where this is my situation, but I have a spouse or partner. They still have their job, they're still making money. So a lot of times people ask this question, and apologies for not having addressed it earlier. The Health Connector looks at your tax filing household. So if you live with someone, but you're not filing taxes together, we don't need to know about what the other person is making. They're not considered part of your tax filing household. But if you have dependents, or you have another person you file taxes together with someone, that is your tax filing household. So we need information about everyone in your tax filing household. But if that other person doesn't need coverage, you just need to indicate, no, they don't need coverage. So I'm hoping that clears up. I know, Nuri, you're preparing questions. So I'm hoping that doesn't mess you up, but hoping that clears up some of those income questions, like, is it just me? Is it me and everyone in the house? And, I'm hoping that helps. And Melissa, always, of course, if there's anything more.
Yeah, no, that clears up, and I think that it'd be great to share with folks the document that lists out, what are the types of income that should be reported, and obviously the materials that we used here specifically during the presentation. So moving on to the next topic here, what is the recommendation for someone who is experiencing some discrepancies or would like to have their eligibility verified? So Melissa walked us through some great tools, and let's say someone is getting a result on there, but then when they actually complete the application, they get a different eligibility result than what they expected. What is the recommendation for those folks?
I would suggest that they call customer service and just ask them to step through the application with them, just to make sure that everything has been completed correctly. It's, we've tried to make this application as simple as possible, but every single question, every single check mark has implications on the back end. So if you check something that you shouldn't have checked, or you included something more that you didn't need to include, all of these details do impact what your final eligibility is. So I would start there. And if you still receive a determination that you're not comfortable with, you want to have researched, they can help you from that point escalate your case and have someone look into your eligibility further.
Thank you, Nikki. Can we just share some information regarding vision and dental insurance? I'll leave that as an open-ended question.
Okay, so dental vision. So some of the plans do offer some vision coverage. So you'll have to look at, if there is a plan that you're really interested in enrolling in, we just need to take a closer look at their explanation of benefits to see what their vision benefits are. So as an example, you may get, sometimes if you go see an eye specialist, that's considered, that actually is covered by your medical coverage because of the type of physician it is, but you got to check with your particular plan. In terms of dental coverage, someone can buy separate dental coverage through the Health Connector, and you don't have to buy it at the time you pick your health plan. You can buy it later. Dental coverage does not have the same rules for open enrollment. You can enroll in dental coverage at any time during the year. However, there are certain things, if you want certain services, if you want to have your dental coverage pay, you may be subject to a waiting period. So, and probably the last thing that's important to state is we don't sell separate vision coverage.
Thank you, Nikki. Excuse me. So what if an individual has insurance that is currently being offered through their employer, but it's not necessarily affordable is the recommendation that they apply for the Health Connector, or are there any other suggestions there?
Melissa, can you explain how that works and what they would need to complete?
Sure. So actually, when you go into the application, you can actually include that information in the application. And just as an extra step, we also have a tool in which you can check to see if your employer-sponsored insurance is considered affordable. I know that it's your employer's sponsored insurance is considered affordable if it's the lowest cost plan that costs less than 8.3% of your household income. But again, if that's confusing, we have a tool. You just go into the tool and you would enter the information and you would be able to find that out.
Great. And if we can just explain this so that folks who may be experiencing some confusion, we have our partner agency, Mass Health, and we are the Health Connector. I'm not sure who wants to touch on just like the application itself and any similarities or differences there.
Sure, sure. So as we were describing earlier, when I had, and then I know people join at different times during the presentation, but we had a slide which showed that there is one application. If you come to mahealthconnector.org and you try to access the application for individuals and families, that is the online application that somebody would need to complete in order to see if they're eligible for coverage either through the Health Connector or Mass Health. So we are separate agencies. However, Mass Health is our sister agency. We work very closely with them. And they, the system will figure out where someone can get their coverage. And if they are eligible for Mass Health, someone goes down a separate path. If they're eligible for a Health Connector plan, they come to us and they go down the path that we've been talking about today. Maybe it's just worth mentioning too that you will get notices from both the Health Connector and Mass Health because it's a shared application. We are legally required to send you notices from both organizations. This essentially was trying to make this feel like a no wrong door, allowing somebody to just come to one place, enter information to one application, and then go from there. Hope that helps explain the affiliation.
It sure does. Thank you, Nikki. So any final words for folks who might have very specific scenarios regarding their eligibility, regarding their household, or regarding income, or anything else along those lines?
Sure. So I'll start and then hand it over to Melissa and also Thalia if there's anything else you'd like to add. But I would say if you have specific questions, especially given what today's date is, today's the 17th, if you're trying to get into coverage for February 1st for yourself or anyone in your family, I'd urge you to call customer service and ask to speak to someone about your application, where you have questions, where you have concerns. If you need additional assistance or additional research needs to be done, they can escalate your case. They'll give you a case number. Make sure you document that. And they'll give you a time frame too for resolution. So take all that information down. So when you call back, they're able to easily look at your account, why you had called, etc., and help you move forward. They're really great and will be able to help you move forward. Now, if you want to try to make an appointment with someone in your area, in particular, if you're looking for someone who speaks a particular language or someone who's close by that you can go and see, definitely go to Find Local Help on our website. And I think we can provide that information if we haven't already. We know it's in the slide deck and it will be in the follow-up email that you're getting, but it's found on our website in a couple of different places. Just enter your zip code, where you live, look at the organizations, and I would honestly, because of the date, I'd just call and make sure someone is available and can make an appointment with you. And Melissa, I'm gonna give it back to you because I know you were saying it's okay to call customer service if someone doesn't speak a language. You know, we have translation lines, so I'll let you
Yes.
give any final words of wisdom because I know we're at 1:12.
Yes, I just want to say we are here to help you in whatever language or however we can help you. We just want to empower you with the resources that we have and just want to make sure that you're making the best decision for you and your family to stay protected with your health insurance. So we are here for you. We have extended hours and during open enrollment. And, just always make sure to reach out to us if there's any need to.
Thank you. And I would just add, I mean, that goes for anyone experiencing any issues at any point in time. If it's something as simple as logging into your account from the very first step, so reaching out for help. And then just kind of to close off here. So, should people wait to apply? Should people wait to make any changes to their account? Or should they do it now?
Do it now, do it now. If you know that you're losing your job, if you know that something's ending, there's no reason for you. You don't need to wait. You can start your application, put the end date in there if you know what the end date is. Again, remember, you can come in, you can update your application. It's probably always a good idea to tell everybody, remind everybody that by submitting an application, you're not binding yourself to doing anything. You're just starting the process and you're checking to see what all of your options are. So if you know that you're going to lose health insurance coverage, just get this process going, get all, and that way when it does happen, if you know it's going to happen in, a week or two or a month or two, you can help somebody get you over that line.
Great. Thank you so much, Nikki. Thank you, Melissa. And thank you to Thalia. We thank everyone who has joined this webinar today. Just a reminder that this recording and the presentation itself, as well as additional helpful links, will be distributed to everyone who is here and has registered for the webinar today. So thank you all for joining. On behalf of my colleagues and everyone at the Health Connector, we wish you well.